Hello, my name is Marcus Chavez and I'm with IFARA TV. Today we'll be cablecasting segments of the press conferences that were held during the 22nd CROI, which is the annual conference on retroviruses and opportunistic infections, which took place in Seattle, Washington this year. This segment will be presented by Helen Payne, who is with University College London in the UK. Helen talks about maintaining sustained virological suppression and the SHARE trial. The SHARE trial looks at early and deferred antiretroviral treatment.
Thank you. So this was a sub-study of SHARE, and the SHARE briefly explored clinical outcomes comparing early and deferred ART in infants less than 12 weeks of age with a CD4 greater than 25%. It also explored the effect of ART interruption in these children. Now, I used stored samples from the SHARE trial to measure HIV proviral DNA as an estimate of the HIV reservoir, and I'm going to summarize the findings from this study. So we found that there was a highly significant difference between early and deferred ART, with the early treatment arm having a far lower HIV proviral DNA. We also saw a highly significantly that cumulative weeks of HIV suppression were related to a lower HIV proviral DNA, and that interrupting ART, unsurprisingly, demonstrated an increasing reservoir. However, at the end of the trial, between all three arms of the SHARE trial, there was no significant difference in the HIV proviral DNA measurements, which suggests that the benefit of starting out early can be lost if antiretroviral therapy is interrupted. Our study identified 5 children with undetectable proviral DNA at several different time points throughout the trial, 4 of which had undetectable DNA after 90 or 96 weeks of antiretroviral therapy. But it should be noted that all children who interrupted ART from the SHARE trial had HIV viral load resurgence during their interruption, so they were not cured. We explored the predictive factors, which might identify children who would have a more rapid HIV proviral load decline, and that these were early age of ART initiation and continuous weeks of HIV viral load suppression. But we also found that children who had lower levels of CMV viremia at the initiation of ART had lower proviral DNA. So this might infer a potential therapeutic treatment strategy to treat CMV at ART initiation. So the implication of this study is the importance of starting out early and maintaining continuous viral load suppression. Thank you.